Hi, this is Dr. Carl Goldkamp. If you're interested in learning about the ketogenic diet like I was, to save my own life, then this is probably the podcast for you. 8 years ago, I knew nothing about it. 6 years ago, it saved my life. 3 years ago, I started researching and talking with some of the authorities in the field and attending medical conferences about this to understand why and how keto so dramatically changed my and my wife's Judy's lives. The purpose of this podcast is to share our journey of discoveries with you in understanding how keto is so effective in improving so many different conditions, from obesity, epilepsy, diabetes, infertility, MS, Alzheimer's, heart disease, to name a few. So take a step away from all the hype you've probably heard and roll up your sleeves with me and join me weekly to explore this living miracle that anyone can access. We'll talk science, we'll talk food. We'll explore its history and evolution to today, which is that the sheer wonder of the ketogenic way of eating has changed untold number of lives, unlike anything before it. And in case I forget to mention it, please join our Facebook group, Keto Naturopath. Hi, this is Dr. Goldkamp, and welcome back to another episode of the Keto Naturopath. Today, I'm kind of blatant with my title, which is, it's the pandemic of the not unvaccinated, but the obesity-induced omega-6, obesity-induced omega-6 population. And why I come to that is this. That's the punchline right up front. I'm going to support that. And also I'm going to show you there's a lot of specious, questionable studies out there that really try to confuse this same old story that goes back to the 60s I've already told you about, which have formed the basis of our nutritional standards. They are so locked in place. They are deeply etched in concrete and stone and granite and whatever. And the resistance, it's not just like, oh, well, there's the truth and there's not the truth. It's the money gets around to support it. It's the same thing if anybody's from the United States and you're confused by the politics. I'm living here and I'm confused by the politics because you get, retroactively, oh, this was a lie and this candidate lied against the other one and that's how they got in or whatever. It's like, you don't know where the truth is on half of these issues. And it just is infuriating. So you tend to pull back and, get your radius of your life gets smaller and smaller of the things you control that you know are true, and the few and the people and so on and so forth. Probably happens the whole world around, but it's just, maybe it's a bigger microphone in the United States. So as an example that I've been working on and I'm not so willing to let go of is the whole omega-3, omega-6 ratio, but where they come from. And it's not just plant-based versus animal-based. And that's kind of like how my education was. So plant-based will give you high omega-3. And if you eat a lot of meat-based, you're going to have high omega-6 and you're going to be very pro-inflammatory. Well, I find that is ridiculously oversimplified. And actually, most of our omega-6 comes from our processed foods. But why does it come from the processed foods? There's a number of variables there, but the biggest thing to choose is it comes from what they call seed oils. Now, this topic is not a new topic. It's sort of making its round of, oh, such and such talked about seed oils and how they're bad for you. Yes, they're bad for you now. They were bad for you before, and they were bad for you a couple decades ago, and they were talked about then as well. Okay, so it comes from, linoleic acid, and that's what you get from plants. That's the omega-6 part of that. So you have a lot of processed foods. You're going to have really high, and it's been well documented. There's a number of studies out there that are well documented saying, over the last 150 years, 100 years even, our 1-to-1 ratio of 6-to-3 is now 20-to-1. And that's a bad thing because it's big. I've talked about this in YouTube's as well. It's associated with so many pro-inflammatory conditions such as arthritis, even psychological, schizophrenia, bipolar, ADHD, which people tend to think of people like myself as kids, dyslexic or even autistic, asthma, Alzheimer's. I don't have the list in front of me, but that's, it is such a big cluster of the top thing, cardiovascular, of course, and cerebrovascular, of course. These are the issues. And so it just has to stop you just have to stop. You have to be your own regulatory agency right now and saying, that's bad. I believe it enough that that's bad. And I need to sort of check, me to stop doing that. Most people, I've gotten so many questions now, how much omega-3 should I take to compensate? That's never been that's a partial answer. And I think that draws to a really superficial level of thinking. Sorry, folks. Omega-3 is fine, but where does omega-3 come from? You're going to say, well, I'm going to get it from my fish oil because you told me about that on other podcasts and YouTubes. That's true. But why not do the appropriate thing? So you need less omega-3 to take as a supplement, and therefore be a citizen of the world and think about, no, I don't want to deplete those sources that give me omega-3. I need less because I'm a more conscious person and I know where my omega-6 is coming from. So that would mean cutting back on your processed foods. You look at that. You can go on to, I've mentioned Chronometer again and again and again. I mentioned that only because it's free. You can go on and do it and track what you're eating, and you will find out on that column where your omega-6 is coming from. But more than that, I say go in and spend $35, call it 100. I don't care if you call it 200, but for $35 from, that's my experience has been, you can get your omega panel and know what your own ratio is. That's really important. Get data on yourself. Don't go running from topic to topic to topic. Oh, I need to take this because. How do you know? How do you know? You don't treat your car that way. You don't go in and just say, I think I'm going to replace the carburetor. Why? Well, it's just one of those things. I've been told you have to replace carburetors. They don't have them anymore. But so approach this with a common sense about you. You need to know things about your body, and it is data. And so I'm asking you to take action about yourself, for yourself, and intervene on your behalf. Okay? This doesn't mean you need a PhD in what I'm going to tell you to do. I'm giving you a small little lab. Go do it. Please stop your fear of labs. You're going to have to get that. And figure out where to get it. You can get it online. I use, as an example only, Ulta Labs. I'm sure there's at least 4 or 5 other labs that you can go without being prescripted this particular lab requisition and go get it done. So now that you have your data, then if you are high, which you will probably be between 10 and 20 as a ratio to omega-6 versus omega-3. Find out where that's coming from. Now you have the onerous task to find out where that's coming from. Just log 1 week of all the foods you eat and have that be a normal week, and you have a reasonable answer to where is it all coming from. You obviously know if you're a processed food eater or not. And if, it's so funny that people who are listening to this podcast obviously are a little more self-aware, and so they probably are healthy just by that. But then the question usually comes out, well, I eat chicken a lot. Well, what kind of chicken? Is it the chicken that's caged, reared, and there probably would be high in omega-6. The question is it high enough for that to be a difference? If you're a chicken eater for your predominant protein source, because I've talked a lot about protein-sparing modified fast, and we have chicken at least once a week, maybe twice a week. And, that by itself, if that's your one most egregious variable in your life of high omega-6, I don't think you'd probably get beyond a 4. But guess what? Prove me wrong. Go get it tested. Say, now you've, documented your week of the food. You did a food diary on Chronometer, or I don't know enough about MyFitnessPal since I haven't used it for years. But I assume it's similar. You get to find out how much omega-6 versus 3 is in your food. So you're going to get your answer 1 week. If you're concerned, put in the time, go do that. You had your labs. Now you got your own documentation. Now you just make changes. And then I would say a quarter from now, go get it tested again. And a quarter out, do it 1 year, 4 quarters a year. And after that, you probably won't need to do it anymore other than curiosity, because you'll know how that you have transitioned away from that. People ask, so back to that person who says, how much omega-3 do I need to compensate for my chicken? I would say, I don't have an answer for that. And my answer is you go back and you get tested, and then you log in your food, and then you see if, first of all, is the number that high that you really need to take care of it? And so if it's moderately high, you probably won't need much in the way of much omega-3 at all, but I would prefer that you then go, maybe I'll diversify my sources. There hasn't ever been a civilization in the world that eats just one source of protein. So you're being kind of weird. So modify, bring your parent inside you that says, maybe eating chicken 7 days a week is not a great idea. Why don't I change that a little bit if that's you? Or you can another person say, well, no, my issue is pork. Well, pork's another one. What do you feed pork? What do you feed chicken? You feed it corn and you feed it soy. So that's why they're high. But the difference is in feeding those animals those things, and pork eats a lot of other things. You can say, well, pork eats processed foods indirectly because of all the slop they bring back, if you know anything about pigs. So whatever, get it measured and then you'll have your story instead of guessing how these things are. But let's just say the pigs on the farm are given corn seeds and they're given soybean seeds. That's not as concentrated as soybean oil or corn oil, or that's pretty much what they're given. So it won't be as high, whereas when you're having processed foods, you're eating the oil. The oil is in the food. It's not like you're eating corn on the cob, or a few people have soybean seeds, edamame, seeds. Yeah, there are some people, but even at that form, it's just not that concentrated. We're talking about the people who cook in soybean oil or corn oil or canola oil or any of the other seed oils. That's the egregious part, and that's where all your processed foods are. So anyway, what my hyper repetitive, almost perseverating aspect of what I'm presenting here is you have a small little test you have to get. You can put it in the palm of your hands. You can go take care of it. You can get your data and buy this. And this just doesn't, it's so unusual. You don't get away with, you don't have to do a whole panel. So unlike everything else in your labs that your doctor gives you, this is just one little piece. And you have significant data there that you then can go and change it. And when you change it closer to back to a 1-to-1, or at least within the 4-to-1 window, some people argue 2-to-1 window, the direction you want to go. And supposedly 100 to 150 years ago, we were 1-to-1. So go back that way. And when you go back that way to that ratio, which means you'll be burning off the omega-6 part, when you gradually make your way back that way, a lot of your symptomology, should you have it, will change. Could be sleep, could be thinking, could be whatever. Or your risk factors, if you like to be academic, will drop. So it's a big deal by moving in that direction. You can do it, but you hardly need much in the way of a lab. It's a small little few numbers there, an omega panel. Go get it done. And you get your data. I mean, I can't say that about thyroid. I can't say that if you were anemic. It's a bigger issue. You have to look at other things together. Why, to really determine the gist of what that issue is. But not with the omega panel. Omega panel is cut and dry. You can change a person's life. You can change your own life with this particular series. So of steps to take, to execute, to implement, to be your own advocate for health. So when I do get the question of, well, how much omega-3, I am so tired of dealing with people that don't want to do the work and just want the answer. It's like, I don't want to go to class. I just want the exam questions. Well, guess what? We all got to go to class. We all got to learn it. So when we get to the exam questions, we present ourselves to those exam questions and see how we do. So let's not think we can hack our way around this. We can sneak our way around this. We can go to the cut in line, whatever those little behaviors are that you had when you were a kid, time to put on your big boy or big girl pants on and do the work of an adult to bring back your health. That's what it's going to take. It's going to take to activate the adult side of you to go down that road and do it. Why I keep coming back to people asking about how much omega-3, and that was a specific question. And somebody said, this is the chick I'm eating. How much omega-3 do I need to balance that? They're never going to get that answer from me. For one, I'm not their doctor. And that speaks to a personality that I don't get along much with. How do I cut in line? I don't have time to wait. How do I cut in line? Well, guess what? I have to wait in line like everybody else. So you're going to wait in line as well, meaning you're going to do the work that I have to do and we all have to do to get there. There isn't any hack there. So if you were in the hospital and your inflammatory markers were huge and they gave you fish oil, omega-3, EPA, DHA, a marine source of omega-3 to be very specific about it, EPA, DHA. Well, that study was done. There was a great study done on that, and it happens to be an Iranian study. And during the time of COVID, and so what I'm leading up to is if you change this factor, you will change. If you want to use COVID, use COVID. If you want to use the flu, use the flu. I'm talking about the symptomology you will incur when you get the flu, COVID, the Delta, the Mu variant, pick your variant, all these problems. And when people have it, people have died. So they're not joking when they get the symptomology. I'm saying, why don't we take a little precaution, do something ahead of time that will drop the likelihood a lot by the severity of the symptoms that would be induced by COVID, the flu. Okay. And so this is out there. And so there's a great potential benefits and risk of omega-3 fatty acids supplementation to patients with COVID-19. And that came out in July of 2020, barely a year ago. So this is new stuff. And it goes through the idea of if you're high in 6 versus omega-6 versus omega-3 and the sources of, and it more than it's worth going through. And I will totally accept without having to go down into prostaglandin formation and so on and so forth. If you are high in omega-6, you will be high in arachidonic acid. And if you are high in that, you will get a lot of pro-inflammatories. Pro-inflammatory means your C-reactive protein marker will be up. It means you will have a lot of platelets out there. You will be more than likely to throw a clot. You'll be pro blood clotting. You will be higher oxidative stress. You will be delayed virus clearance, more difficult for you to activate your immune system. So there's an immune part of omega-3, by the way, right? Of the marine-based omega-3, you have that. You are doing this for your immune system. If that makes you feel better to think along those terms, and then think of omega-3 as being an immune support. You will, let's see. You will, if you are high in omega-6, you will increase your susceptibility to, I said, oxidative stress. You will be producing a lot of pro-inflammatory prostaglandins, thromboxanes, et cetera, and just that's enough on that side. So I hope you take that, and I hope you do that. This is something that is actually actionable. I mean, to think that I had to go through 20 years or so of being a doctor, seeing patients, and so on and so forth, in which if I just had my little judge hammer there and slapped it on the table every time I had an interview and said, this is what we're going to do. This is the single one thing we're going to do until I see you next time in 6 weeks or a couple months. And after that, I say, we're going to take dairy out of your diet for 2 months. Then we're going to take wheat out of your diet. And so if I did nothing but those three things, first thing would have been, right, get tested through your omega panel. Right now, I already knew they had to, in order to see me, they had to have their diet diary. So I know what they're eating. They would have put it into Chronometer as an assignment. We've seen what we need to reduce their omega-6, and then dairy out, wheat out. That would be a tremendous difference. And I'm not saying that I hate wheat or I hate dairy. I come from the perspective of simply having taken that out of so many people's diets for 2 months. That was the agreement. We're going to have an agreement. We're going to tussle for 2 months to get this out of your diet. And then we're going to have a pleasant conversation on the other side in which you have the rest of your future to eat as much dairy and wheat as you possibly want. But we're going to find out what's it like without that. And we'll look for fun substitutes so you don't feel so deprived. Anyways, these are big deals. This is at the level of the patient. It doesn't have to be much more sophisticated than that. We can go into why dairy affects so many different people. And by the way, it's more than just A1 and A2. It's more than, it's not lactose intolerance. It's more than allergenic. It goes into a lot of different things. And And I love dairy. In fact, my wife, Judy, just made a cheesecake for us to film some point in the future to put on the YouTube. And so, primarily the plan was to freeze it for Christmas, end of year. Her birthday's in December, and end of year is a good time to pull that out, kind of thing. So we both had a piece of it. Now I can have one exposure to that kind of dairy, and cheesecake is a lot of dairy. That's heavy dairy. And I can get by with one. But if I have a second one the next day, it is going to really almost make me feel like I have a flu for a couple of days. So for the film, I had a bite, tasted it, and it was incredible what she did. And well, then the next day we had our 25th wedding anniversary. So shouldn't we have that? The night before we did have it. And it's like, wow, did that ever make me feel miserable? It was my second time. And there's an immune explanation for that. It's the second exposure that's going to activate your system to go up, be careful. So you had it one, you woke up your immune system. It remembered what dairy was like. And the second piece was, let's clobber this guy. And there are all out, full inflammatory, respiratory, all the different things, GI. So you can get by with one, can't get by with two if you have a situation like me. That's just my reality. So, and there's many people like me, and there's many people that are not as worse as bad as me, and there's many people that are far worse. And it does affect you. So by taking these things out, it's like taking static out of the noise of your room. Suddenly it gets quieter and you can hear yourself think, and you can hear the good music. You can hear people speak. You can kind of like have a clarity, a mental clarity to be able to relate to whoever you're listening to. It's an awesome thing to help induce in your own life, in your own livelihood. So, yeah, that's the bad news. So when Judy makes ice cream, it's dairy-free. When she makes anything else, it's dairy-free. But that was the one exception. And it wasn't much fun to have that. Finally got over that part. So I'm just saying, there's these things. And if I had a practice, if I did just those three things, people would have said, oh, you're so superficial. Why don't you give me your special Chinese formulas? Why don't you give me this? Why don't you give me some of your special supplements, that you talk about when you do these medical presentations? Why don't you give me all these different things? Sure. Yeah, you can buy all those different things, and there will be helpful to you to get you over an uncomfortable part of your life, whatever that thing is we were talking about, whatever symptomology we're trying to reduce, assuming it's unhealthy. So that's it. Those are the three big things. This is the privilege of looking back over those years and saying, if I could go forward, what did I learn? Not so much what I went to school to learn. That's academic. There's a politically correct sort of agenda in presenting medical information. First of all, you need to provide the information to get them to pass their exams, right? So that means it's a chunk of information that is pretty standardized. And they need to pass the medical exams, and then you get on to more esoteric therapy classes, botanical medicine, hydrotherapy. I did acupuncture and so on and so forth, but that wasn't part of the naturopathic. So that was my aspect. To come back to what I used as an image for this particular podcast is that it is a pandemic of the omega-6 induced obesity. Where did this obesity come from in our lives in the last 50 plus years? I know obese people have existed before. I've told you about, the history and the evolution of the ketogenic diet. In the 1800s, you had William Banting, who came with the Banting diet that he got from Harvey, who got from Dr. Bernard, and so on. And this is in the 1800s. And as it came forward, it became kind of the precursor for the ketogenic diet in the 20s. And from there, you could say the Pennington diet into the Atkins diet about dropping the carbs. And so all of these things were out there because people were heavy before. The primarily reasons for those particular diets that I referenced, apart from the original ketogenic diet, was about people losing weight. They needed to lose weight. And we know obesity existed before. But now we have obesity on such a scale worldwide that it is we're sinking under the weight of it. It has severely compromised our immune system. That's why when we talk about COVID, the association with obesity, or the politically correct term for not identifying the visual image of somebody who's heavy, is to say, well, they're metabolically unfit. They're metabolically unfit, most likely, or the metabolically unfit population in the United States in this particular case, 99% of them are going to be very heavy people. So that's how we avoid saying very heavy people. So these metabolically unfit people, how do they get there? It's not like people in the 1850s were smarter, or 1750s were smarter. They were all struggling, just like we're struggling to make our own livelihoods today. So we have a different kind of education, and we are more educated, quote unquote, in the information that's kind of come up to us. But apart from each other, it's not just the smart that are healthy. We collectively got unhealthy. Our longevity, how do I say this? A number of years our longevity statistics are decreasing. And it's happened 3 years, not in a row. In the last 4 years, 3 of the last 4 years, our average lifespan, thank you very much, average lifespan has decreased. Why has it decreased? One of the reasons is because of our compromised immunity. Where did our compromised immunity come from? It came from what we're eating. And specifically, I would say of what we're eating, you can say refined carbs and everything else. Yep, that's part of it. But I think primarily the biggest elephant in this room at this time is the processed oils. They're not just seed oils, but for the most part they are. And they hadn't existed before, in evolution. So all these other seed oils that we had as oils, not as seeds. So when people talk about walnut oil versus eating walnuts, they're almost two different things. The concentration of the oil that you get in the walnut is probably 1/100th of that, if even that, or of anything else. So all these oils are there that are heavy omega-6, the processed seed oils that are used in foods. And so consequently, we have really tipped that scale, and it affects everything. It is not a small little thing. It's not one more little thing you can add to your list of things that you have to do every day, like go out for your walk, or perhaps if you're really at the edge, go for your high intensity training. That would be great. Go do that. You have to do this. You have to do this. This is one of the have to do this, is get that ratio back in balance, do it yourself, and don't feel you have to proselytize the world about what you're doing for yourself. Just do it yourself first. Get into better health. Then go work out, preferably HIIT, but something's better than nothing. And if you're anywhere over 40, you do have to be thinking about things like sarcopenia, which means you have to do some weight resistance training. You got to stimulate these muscles for them to be produced, or to stay at the size they are. If you don't do that, you will waste away. And if you don't change your ratio of omega-6 to 3, you will induce a number of conditions that makes getting older not much fun. How do you want the last 50 years of your life to go? Every so often you sort of get a number of people that you knew, whether they're celebrities or personal in your family or friends, either died prematurely, or they suffered a stroke or a partial heart attack, and their lives were permanently compromised. Clearly, those who have died, permanently compromised. Others, and I know 3 or 4 people that I've primarily grown up with, and they could have been as healthy as myself, or I could have been as unhealthy as they were if I made their choices. And yes, there is a degree of genetic predisposition, no doubt. But if you're going to hide in that and say, well, I'm predisposed to blah, blah, blah. Well, guess what? If you change your diet, your predisposure is probably going to disappear. Poof. And I do believe, and I do know about genetic predispositions. We do the whole genomic sort of workup, but let's not hide behind that. It's like, oh, you got that gene. Oh, it's too bad. Why bother? Huh? No, there's plenty you can do. So I know I rambled here, but it is a stake in the ground issue to really get it assessed, monitor yourself, find out what that source is, monitor yourself, and bring it down. You will have profound changes. Just go do it. Don't look for 15 reasons not to do it. And by the way, if you want to look for 15 reasons not to do it, there's 50 or 100 reasons not to do it. There's still fraudulent information out there that simply says, and it goes like this. So back with those two studies, right, back in the 60s and 70s, and the basis for our nutritional guidelines, it was that, well, you need to add polyunsaturated fats to bring down your cholesterol. When you bring down your cholesterol, you'll have lower cardiovascular disease, coronary heart disease, cardiovascular disease, atherosclerosis, and the same can be said for cerebrovascular, right? Well, the first part was you brought down your cholesterol. The thing is, cholesterol is not an issue to bring down. All that is based very fraudulent. But anyway, you can get, whether it's Harvard you can go to. I just read another study that came back with the same conclusion. There was this, as I mentioned in the podcast before about, well, linoleic acid, it actually gets there. It can block the spike protein on COVID-19. And that was a year and a half ago. We've never heard anything since. That, to me, is the corn industry and the soy industry getting behind and producing this true but not true study. We know pharmaceutical companies do the same thing. Without getting too much into that, I'm giving you something small that you can act on that is very important. It's transformational. And if you have influence in your family, then bring it to your family, your kids, your spouse, your partner. Don't take it lightly. Have a good, clean life. And this will lead to, on this aspect, I'm not asking for you to transform all of your life and all of your choices, just this little example. Go do it, because it is directly going to affect the severity of your response to the flu. Till next time, take care. Bye-bye. Hi, this is Dr. Goldkamp again for a brief reminder of something I completely forget to do at the end of every episode. You've heard me talk long enough and many different episodes, but what I would love you to do, and many of you have already done this, I just want to reinforce this particular behavior, which is to send me your questions. Send me your questions and anything you have about keto. If there's something that I don't know, I will look it up. And if it's something that intrigues me, I will probably make an episode, a podcast about that particular topic. So what you need to do is to send me your questions at drgoldkamp@ketonaturopath.com. So that's DRGOLDKAMP at KETONATUROPATH.com. Dr. Goldkamp@ketonaturopath.com. Feel free to join our Facebook group, which is also ketonaturopath.com. That's been growing lately. You also have to answer a questionnaire should you choose to join. And I don't ask for your email. I ask that you follow our terms. I try to avoid advertising and the obvious interruptions of just a good Facebook group. So hope to see you at one place or other. Please send me your questions and look forward to talking to you and getting to know you. Take care.